and welcome to the first edition of Public Health Matters, a new monthly program dedicated to discussing public health issues in our community. This program is sponsored by the Middle-Brook Regional Health Commission, which serves the communities of Bound Brook, Greenbrook, Middlesex, South Bound Brook, Warren, and Watchung. My name is Colleen McKay-Wharton, and I'm the health educator for the Commission and the host of this new program. Our goal for Public Health Matters is to give you a program that will provide useful information to help you better understand important public health issues, and in particular, what you can do to reduce any risks associated with them. Our topic for today's program is one that has been in the press quite a bit these past few months, and that is MRSA, which, as you may know, is actually an abbreviation for a particular type of bacteria. And we'll be learning more about exactly what that means in just a moment. With us today are two guests who will address MRSA from two separate, but becoming less separate, vantage points. Our first guest is Patricia LaFaro, the Director of Infection Prevention with Somerset Medical Center in Somerville, and she'll be discussing hospital-associated MRSA and its impact in a hospital environment. Ms. LaFaro is also the past president of the Northern New Jersey Association for Practitioners in Infection Control. Also joining us today will be Dr. Corey Robertson, Medical Director of Emerging Infectious Diseases with the New Jersey Department of Health and Senior Services. Dr. Robertson will be discussing community-associated MRSA and its potential effects on the public. Most importantly, both speakers will be discussing what preventive measures you can take to reduce your risks of infections from these potentially serious bacteria. So we thank you both so much for joining us.
Thanks, Colleen.
Pat, why don't we start with you?
Sure.
Can we first look at the actual name of the bacteria, MRSA, and what does that actually stand for, and what does that actually mean?
Sure. MRSA stands for methicillin-resistant Staph aureus. Okay. And what that means is that many people have the organism Staph aureus. We carry it on our skin in mucous membranes. Mm-hmm. It's a very common bacteria. Okay. But MRSA is a much more resistant form of this bacteria, and frequently can cause more serious disease. Okay.
Now, it's often referred to as just staph, right? Sometimes staph infections.
Infection,
okay.
Yes.
Now, is this MRSA really the result of a resistance that's developed over time to antibiotics? Is that?
Well, bacteria become resistant in many different ways. Okay. One of the ways is the use of antibiotics in hospitals, also the use of antibiotics in the community. Okay. We use a lot of antibiotics frequently for things that are viral that really shouldn't be treated with antibiotics. And so your system develops resistance to certain types of antibiotics if you've been exposed to them frequently. Okay. Some bacteria are also can pass their resistance on between bacteria. So if you have one resistant organism and that bacteria and you have another organism in your system, they can actually share and pass on their bacteria genetically. Okay. And one of the other issues that we have with resistance is that in our food chain, there's so many antibiotics that are used in the feed that we feed our animals, you know, to try to protect them from certain diseases and get healthier, fatter chickens and beef, and so there's a lot of antibiotics in many of the things that we use. Right,
right, and we'll often see now in packages of chicken and beef, no antibiotics used here, and
Correct.
That certainly is, I assume, trying to address that issue.
Correct.
Right. Now, there was recently a study done earlier in October of this year, and this was published by the Journal of the American Medical Association. And I just want to be sure that I get this accurately. What it estimated was that in 2005, there were approximately 94,000 cases of the most severe types of MRSA here in the United States. And although we've always known it's here, that was actually 3 times higher than what their previous estimates had been. Are we seeing this more frequently in the hospitals now? Is this a new superbug or not really the new superbug that the media makes it out?
It's not a new superbug.
Okay.
In a hospital setting, we've been seeing MRSA since the 1970s, the mid-70s. Okay. But it was in very low numbers in the 1970s. Okay. As time progressed, it's increased significantly over time. And by around 2005, most of the staph infections that we see in healthcare about 63% of them are caused by the staph organism MRSA. So it has significantly increased over time.
Right, and certainly that's adding to the great concern that the healthcare industry is having.
Correct.
Right. Now, are there certain units in a hospital where they're more likely to see MRSA infections, or is it across the board?
Well, it can happen anywhere, but the most likely are in your critical care units where your patients are severely compromised from their illnesses. We do many multiple invasive type procedures. They all have intravenous going, at least one, if not two. They have Foley catheters frequently. Many of them are on ventilators to help them breathe for certain periods of time. So any patient who has any type of invasive procedure done is at a greater risk of developing a MRSA infection.
Okay. And you actually alluded to two things there. One, just being in that weakened immune state, I guess, puts us at greater risk to begin with. And some of the invasive procedures that you mentioned, are any of those more likely than others to be a common site of the infection?
Well, certainly intravenous catheters and ventilators are probably the most prominent in a healthcare setting where we do find our MRSA being caused.
Okay.
So,
and then how would that infection then typically spread? So from patient to patient, I guess that can happen?
MRSA is a contact spread organism. So if I care for one patient and I go on and care for another patient and I haven't used good hand hygiene, or I haven't washed my hands with soap and water, or I haven't used the alcohol waterless soap, it's very easy to take the organism from one patient to the next patient. If people don't disinfect equipment, there's stethoscopes, different equipment we use on patients. You want to disinfect it before you use it on the next patient. And frequently what happens is that we have colonized patients, patients who aren't sick with the MRSA organism, but carry the MRSA organism. We may not know that they have it, and again, there, a breakdown in technique by a healthcare worker can spread that organism to another patient.
You know, I imagine given the intense environment of a hospital, although the best intentions are there to hand wash every time between patients, to do all the right procedures, I imagine it often becomes just a matter of time and pressure to get to the next task at hand, that it's very hard to keep up with those. The things you know are the right things to do. That's right.
You know, caring for patients, and it has to become almost inbred that hand hygiene is very important, and hospitals for many years now have been trying to educate healthcare workers to the fact of how the simple procedure can save lives.
Right. Now, are there certain things hospital staff may be looking for, say if it's a patient in intensive care or some other unit, are there certain clues that a hospital staff member might see in that patient to make them think, you know, this patient may be at greater risk, or there may be an infection?
Well, obviously any patient who has any invasive line and is at greater risk. The signs and symptoms of MRSA are really not any different than the signs and symptoms with any infection with any bacteria. You know, a patient spiking a temperature, having an increased white blood cell count. Sometimes the type of sputum that they're producing if they're on a ventilator can tip off a nurse that it looks like it could be MRSA. But any patient in a healthcare setting for a long period of time who spikes a temp or starts to look like they have an infection, certainly MRSA would be one of the major organisms